Welcome to Ask Coach. Today we're going to talk about cold whirlpool or hydrotherapy for recovery. A lot of mixed information out there. Some people say they're bad, some people say they're good, some people say they don't make any difference. As a college strength coach, trained over about 2,500-ish athletes, and competitive Olympic weightlifter myself, I can tell you they work. Great results. And the big thing you notice is an increase in your ability to perform the same workout a little bit sooner, especially after this hard physiological workouts, in other words, high volume workouts. And you get a big decrease in the amount of soreness that you get after workouts. So whereas, without the cold whirlpool, you may be sore for several days after a workout, with the cold whirlpool, you tend to have very little soreness. And the period of soreness is greatly limited by, instead of being 3, 4, 5 days, it may only be 12 hours or so, and it tends to be pretty mild soreness, even with very hard workouts. Now, do you get a difference in, explosiveness, change of direction, vertical jump, anything like that? No, you don't. Those are more neural, and assuming that you're not so sore to inhibit contraction, they're really not affected by physiological fatigue. Now your ability to do them for a volume, so instead of doing one vertical jump, doing 100 vertical jumps, that would be affected. But your ability to do one explosive movement, you see no effect. And actually, that's what most of the research shows. So looking at some of the latest research, actually this month, the Journal of Strength and Conditioning had an article published on hydrotherapy, and they showed, again, no difference in the explosiveness, so vertical jump or acceleration, anything like that, but what it did show was a big decrease in one, perception of fatigue, as well as pain after the workout. In other words, DOMS, delayed onset of muscle soreness. So the cold whirlpool, a great tool. You can invest in one for home pretty inexpensively. Buy a bagged ice, and you just go to your local ag center and buy a 100-gallon tub that you might use for watering horses or cows. It's actually about perfect for most people, and you just fill that full of water and drop in about 20 to 40 pounds of ice in it. Now, what temperature are you looking for? What's your duration that you're looking for, and how often should you do it? Let's start with how often. After every hard workout. So if you do 3 or 4 hard workouts that week, you're going to do that after every workout. You want to do it for about 10 minutes. And you want your water temp to be somewhere between 55 and 65 degrees. Okay, a little mild shivering, really what we're talking about, just chattering in the teeth, that's okay. You don't want violent shivering. That means the water is too cold for you. I really encourage you to use the thermometer. Don't guesstimate it. Any thermometer will work. And it's great to have a circulation of some sort, so you can use a small aquarium pump, or you can just move around in the water. You actually warm the water up around you when you sit still, so by moving a little bit, not a lot, just a little bit, you're circulating that water and keeping the cold water close to your skin, so you get a better effect. How does it work? Really, short version is to protect yourself from the cold, your body takes the blood in your limbs and moves it to the core. While it's there, it's getting reoxygenated, and then when you get out of the water to warm your limbs back up, your body will take that freshly oxygenated blood and push it back out to the limbs. So you're getting some fresh oxygen there, bringing fresh nutrients there, and that dramatically increases your recovery time. So it's a great tool. You can do it for about $100 at home. Really encourage you to invest in it. It's one of the best recovery tools that I've ever used. What about contrast baths? So doing a cold bath and a hot bath. Research doesn't really show. There's a lot of, 10 years ago there was a big push for that, but research doesn't really show that you get the results with that. And actually some research shows that it actually decreases the recovery time as far as your soreness. So in other words, increases your recovery time, meaning that instead of being sore for 3 days, you may be sore for 4 or 5 days. So not a big fan of the contrast bath. Cold whirlpool is great. Really encourage you to try it out. Thank you, and we'll see you on the next post.